Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then we have unilateral, now painless. Unilateral, painless, axial, or central cyanosis. So unilateral, painless. It is painless, axial or central cyanosis. This can also be due to the tumors like hemangioma, meningioma, glioma, and schwannoma. Meningioma and glioma and schwannoma are optic nerve or CNS disorder, CNS tumors. So they are, if their CNS tumors goes to the optic nerve, so optic nerve is definitely present at the end of the eye to one side. So whenever there is a tumor here, it will push the eye forward. So it is a central proptosis definitely, and it is painless, and it is unilateral because it can be seen on one side. So examples are hemangioma, meningioma, glioma, and schwannoma.
thank you and thank you for watching.